Geriatric Essentials deals with nutrition of elderly, geriatric rehabilitation, geriatric legislation, false answers, vaccination of elderly, ethical issues of elderly. Causes of post-neonatal mortality are diarrheal disease, malnutrition. False answers, acute respiratory failure, drowning, sepsis. IMCI strategies contribute to improve case management, health system, family practice, community health. False answer, community nutrition. Age-related geriatric medical disorders are hypertension, osteoarthritis. False answers, leukemia, rheumatoid arthritis, rheumatic fever. Common behavioral problem among children are school phobia, headache, delusion, hysteria. False answer, euphoria. Danger signs during labor are cord prolapse, rupture membrane, meconium stained liquor. False answer, obstructed labor. Fetal heart rate 140 by mm. Indicators of maternal and child health care include MMR, IMR. False answer, crude death rate, child immunization rate, contraceptive prevalence rate. Cardinal features of severe dehydration are absence of tear. False answers, convulsion, depressed frontally, increased thirst, tachycardia. Leading causes of under 5 mortality include respiratory infection, diarrheal disease, malnutrition. False answers, malignant neoplasm, influenza. Malignant neoplasm, influenza. Pillars of safe motherhood are family planning, primary health care, antenatal care, essential obstetric care. False answer, women's empowerment. Causes of low birth weight are less birth spacing, drug abuse. False answer, adolescent pregnancy, obesity, gestational diabetes. Live birth is used as denominator in maternal mortality ratio, perinatal mortality rate, infant mortality rate, under 5 mortality rate. False answer, crude birth rate. Vaccines which can be administered during pregnancy are hepatitis B vaccine, tetanus toxoid, rabies vaccine. False answers, varicella vaccine, live influenza vaccine. Components of EOC are obstetrical first aid, basic EOC, comprehensive EOC. False answer, administer prenatal oxytocin drugs, surgery and blood transfusion. Basic components of reproductive health are safe motherhood, reproductive health of adolescent, family planning, infant feeding. False answer, family medicine. Components of IMCI strategy are improve case management skill of health staff, improve health system for effective management of childhood illness, improve the family and community practice. False answers: improve female education, ensuring women empowerment. The signs in Apgar score include heart rate, skin color, muscle tone. Heart rate, muscle tone, skin color. False answers: blood pressure, turbid urine. Common risk behaviors among adolescents are substance abuse, anorexia nervosa, self-injurious behavior. False answers: chewing tobacco, extramarital sexual exposure. High fertility rate in Bangladesh is due to low age at marriage, low level of literacy, poor level of living. False answers: poor health facilities, over density of population. The essential service package includes child health care, communicable disease control, reproductive health care. False answers: maternal health care, vector control program. High fertility rate in Bangladesh is due to early marriage, low literacy rate, poor health awareness. False answer: high density of population, poor health facilities. Common drugs used by the drug addicts are stimulants, sedative, narcotic, analgesic. False answers are laxative. Drug dependence is characterized by withdrawal symptoms, dose response relationship, repetitive use of drug, behavioral disorder. False answer: compulsion for drug. Causes of high fertility rate in Bangladesh are early age at marriage, low rate of literacy, high population density. False. Poor level of living. True. True answers are early age at marriage, low rate of literacy, poor level of living. False answers: poor health facilities, high population density. Basic components of reproductive health include safe motherhood, adolescent reproductive health. False answers: family medicine, road traffic accident, responsible parenthood. Following are the direct causes of maternal death: hemorrhage, obstructed labor, pregnancy induced hypertension. False answer: antenatal hepatitis, gestational diabetes, pregnancy induced hypertension. Following are the direct causes of maternal death: hemorrhage, obstructed labor. False answers are antenatal hepatitis, gestational diabetes, pregnancy induced hypertension. Common causes of neonatal mortality in Bangladesh are acute diarrhea, premature birth, infection. False answer: severe jaundice, birth asphyxia. Which factors contribute to high risk pregnancy? Age less than 20 or more than 30 years. False answers: first or fourth pregnancy, birth interval less than 2 years, inadequate rest during daytime, height less than 145 cm or 58 inches. Which statements are true for hepatitis in pregnancy? Liver failure, enlarged liver, cirrhosis of liver. False answer, antepartum hemorrhage, postpartum hemorrhage. Common risk behaviors among adolescents are substance abuse, sexual risk behavior. False answers, frequent hangout program, suicidal behavior, opportunistic relationship. Following are the components of essential service package: antenatal care, family planning, behavioral change, communication. False answers are diabetes care, critical care. Essential service package ESP এর আন্ডারে আছে রিপ্রোডাক্টিভ হেলথ কেয়ার, চাইল্ড হেলথ কেয়ার, কমিউনিকেবল ডিজিজ কন্ট্রোল, লিমিটেড কিউরেটিভ কেয়ার, বিহেভিয়ার চেঞ্জ কমিউনিকেশন। এখানে এ আর ডি ট্রু বলছে, অ্যান্টিনেটাল কেয়ার, ফ্যামিলি প্ল্যানিং। অ্যান্টিনেটাল কেয়ার, ফ্যামিলি প্ল্যানিং আর হচ্ছে বিহেভিয়ার চেঞ্জ কমিউনিকেশন। অ্যান্টিনেটাল কেয়ার এটা চাইল্ড হেলথ কেয়ারের আন্ডারে পড়ছে। আর ফ্যামিলি প্ল্যানিং এটা হয়তো রিপ্রোডাক্টিভ হেলথ কেয়ারের আন্ডারে পড়ছে। ডিরেক্ট অ্যান্সার দেয়া নেই। Physical dependence is produced by heroin, cocaine, alcohol, barbiturate, methadone. Components of integral management of childhood illness are improvement of health workers' skill, improvement of health system, improvement of family and community practices. False answers, improvement of healthcare delivery, improvement of physicians' skill. Components of integrated management of childhood illness are improve case management skill of health staff, improve the health system, improve family and community practice. False answers, improve referral system, remove cultural barrier. Total live birth is the denominator of infant mortality rate, neonatal mortality rate, maternal mortality rate. False answers, crude death rate, cause specific death rate. Measures of fertility are total fertility rate, child total fertility rate, child woman ratio. False answers is fertility rate, child dependency ratio, still birth rate. Common direct causes of maternal mortality are hemorrhage, unsafe abortion. False answers, malnutrition, anemia, congenital heart disease. Causes of childhood diarrhea includes rotavirus, enterotoxigenic E. coli. False answers, streptococci, haemophilus, campylobacter. Acute upper respiratory tract infections include acute epiglottis, otitis media, laryngitis, common cold. Acute epiglottitis, otitis media, pharyngitis, laryngitis, common cold. Elements of essential service package are: answer, child health care, reproductive health care, behavioral change communication. False answers: integrated support device, sector-wide management program. Growth chart is used for growth monitoring, identifying high risk children, planning and policy making. False answer: complementary feeding, identification of children. Causes of neonatal mortality are prematurity, birth injuries. False answer: preeclampsia and eclampsia, birth asphyxia, advanced maternal age. Most common causes of mortality of children in Bangladesh are diarrheal disease, acute respiratory infection, accidents, congenital anomalies. False answer: tetanus. For estimation of MMR, following data are required: number of maternal death due to complication of pregnancy, number of live births. False answer: number of pregnant women, number of deliveries, number of women in reproductive age. Oral rehydration salt contains sodium chloride, potassium chloride, sodium bicarbonate. False answer: calcium chloride, calcium bicarbonate. Old age is especially associated with atrophic changes in bone marrow, heart. False answer: bone, kidney, lung. High fertility rate in Bangladesh is due to early age at marriage, low rate of literacy, poor level of living. False answer: poor health facilities, high population density.